Anastasia, America's Dental Hygienist, and your host for Curaprox video series. Today, I am here in California with Dr. Robert Levine. Welcome.
Hi, thank you.
It's
Pleasure
great
to be here.
to see you. You know what? He helps out sharing how we can make our patients' oral health better, and he's more known with lasers, and he does hands-on programs. But you know, with Curaprox, we all know the toothbrush, but you found a natural fit, no pun intended, with the interdental brushes. Tell us about that.
The interdental brushes from a restorative, actually I have two components. One from a restorative aspect. I teach at Arizona School of Dentistry and Oral Health. And you know, when you work with students and putting crowns in, etc., cleaning away cement, and what we found is when we utilize the interdental brush after we flossed and cleaned away cement, guess what? We pull out multiple pieces of cement aside from what we thought were there. And so it's a great adjunct for what we have. As we know, if we leave cement in there, iatric dentistry, we take care of one problem, but we now cause another one, and now we have a perennial situation. So we've been able to utilize it in that particular area, and it's worked and been highly successful.
That's amazing. Now, what about, we were talking about fibromas and surgeries. How does that work for a patient?
Okay, basically when we do a surgical procedure, okay, the patient, we do fibromas, sometimes we use secondary intention healing, and in the situation, I did a Florida mouth lipoma last week, and we had to suture it up. One of the areas the patients are very reticent about putting anything near those surgical sites. And I always recommend utilizing vitamin E as a topical area over the laser band-aid that's been provided. So if we can put that material into the surgical site without causing any pain for the patient, we are going to get tremendous compliance. And you know something? With the surgical brush, I think it's the 11,200 person surgical brush, we have gotten tremendous success. We are able to have the patients put the medicaments or whatever we want on those surgical sites. Patients have been very comfortable with it, and then they will maintain and keep the area spotless clean until I see it for their post-op visits.
Absolutely, because you know what, I love that, because most people, but they're so in that mindset of flossing, and with Curaprox's interdental brushes, it's not the mindset of flossing.
Right.
I love that.
Absolutely, but you know, we never go away from using everything. I found one thing within in dentistry and lasers, we take every component we have to get success for our patients. Not that we necessarily walk away from flossing, but flossing alone will not do.
And if you have any more questions, please find us on Facebook, Curaprox USA. You can find Dr. Levine online also. I want to thank you for your time today.
Okay, thank
Until
you.
next time, take what you learn and make a difference with it.